Hi, good morning, Professor. Myself, Prinkpal Kaur. My student ID is 1412832234, and here is a 360-degree view of my room. Hi, good morning.
Good morning.
Myself, Prinkpal Kaur, and I'm your student nurse from Seneca College. And doctor have ordered a head-to-toe examination for you. So I will be conducting that just to get a baseline data of your health. Could you please provide me your full name and date of birth?
I'm Suman Rani and 26 Jan 1992.
Okay, can I see your ID band, please? Okay, it matches with my record. Okay, I'm gonna perform my hand hygiene first. I'm gonna provide you some privacy. Do you have in pain?
No.
Do you know to any allergies to food or medication?
No.
Okay, starting with the neurological assessment, I'm gonna assess the level of consciousness. Do you know where you are?
I'm at hospital.
Okay, do you know what year it is?
It's 2024.
Okay, do you know who's the current Prime Minister of Canada?
It's Justin Trudeau.
Okay, so it states that my patient is fully oriented to time, place, and person. Moving further with Perla. Okay, just look at the tip of the pen, please. Okay, so it says that the pupils are equal, round, and reactive to light and accommodating. Moving further, could you please repeat after me? I'm so beautiful.
I'm so beautiful.
I'm so blessed.
I'm so blessed.
Could you please raise your eyebrows? Smile for me. Thank you. Could you please tuck your tongue out? Okay, so it said there's no abnormalities, no slurred speech, no facial drooping. Now I'm gonna move further with the pronatal drift. Could you please stand up and keep your arms straight with the palms up? Close your eyes. I'm gonna assess for the pronatal drift for at least 30 seconds. Perfect. You can have a seat now. So the pronatal drift is not present. Moving further with the respiratory assessment. Could you please turn around? Okay. Now take a deep breath. One more. Okay, so the retraction and the expansion of the chest wall is equal bilaterally. The breathing is non-labored and the rate is 20 breaths per minute. Starting with, I'm gonna auscultate the breath sounds. There are 10 landmarks anteriorly and the 18 landmarks posteriorly, starting from the interior, starting from the clavicular space. Okay, could you please turn around? Starting for the posterior landmarks from the scapular region. Perfect. So the breath sounds are clear in the lung field and there is no any presence of stridor, cracker sounds. Okay, so moving further, now I'm gonna do the cardiac assessment. So, okay, so I'm gonna check the heart walls, the landmarks. I'm gonna start with the aortic pulse. This is the clavicular bone, and over there this is the first intercostal space and this is the second intercostal space. There is the aortic pulse present at the right side of the intercostal space. To the left side, second intercostal space, that is the pulmonic valve. Third intercostal space, where the Erb's point is. Fourth intercostal space, where the tricuspid valve is present. Fifth intercostal space, the midclavicular line, where the mitral valve and the apical pulse is present. So now I'm gonna check for the apical pulse for at least 30 seconds. That is present in the fifth intercostal space, the midclavicular line. Okay, so the strength is +2 and the rate is 82 beats per minute. No abnormalities are present like murmurs. Okay, so I'm gonna start with the abdominal assessment now. Could you please lay down for me? Now I'm gonna inspect for the abdomen. I'm gonna check the symmetry and the contour. Okay, so no lesions, no scars, no bulges, no masses are present. I'm gonna have a side view now. Okay, from the foot inside. Okay, so the abdomen is flat, symmetrical, and there is no any discoloration, lesions, or the scars are present of the abdomen. Now I'm going to start with auscultating the vowel sounds. Starting from the lower right quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, vowel sounds are present and are normoactive, and are 2 to 3 vowel sounds are present every 5 seconds. Now I'm gonna palpate the abdomen, following the same direction: right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Do you have any pain?
No.
Okay, so I have done the palpitation, so there's no ascites, no swelling, no edema, no bulges, no masses are present, and there is no any pain. You can sit down now. Now I'm going to assess the upper and the lower extremities. May I have your hand, please? Okay, I'm going to assess the skin on the upper extremities and the lower extremities. Okay, so there is no bruises, no lesions, no deformities are present. The skin is intact and is fully hydrated. Do you have any pain over the arms or over the legs? Okay, so there is no pain. I'm going to check the bony prominences for the skin integrity to check the pressure ulcers or any sores are present. I'm going to check the elbow, wrist, the knees. Okay, so there is no any pressure ulcers or the sores are present. Now I'm going to check the skin integrity on the both of the arms. Okay, so the skin is snapping back within 2 seconds. Now I'm going to check the nail consistency and the capillary refill. Okay, so nails are all clear and there's no cyanosis, no clubbing, no brittleness. Okay, now I'm going to check the capillary refill on the both of the hands. Perfect. So the blood is gushing back within 2 seconds. Now I'm going to repeat the same on the lower extremities to check the capillary refill. Okay, so the blood is also gushing back within 2 seconds on the feet. Okay, now I'm gonna, okay, just give me your hand, squeeze my hand. Okay, just push me and pull me. Okay, now I'm gonna check the strength for the lower extremities. Apply pressure towards my hand, downwards. Okay, so the muscle strength is 5 out of 5 over the and resistive. Okay, so I'm gonna check the pulses now. I'm going to check the carotid pulse, and the carotid pulse that is present at the sternocleidomastoid muscle at the level of thyroid cartilage. Now I'm going to check the other side. Now I'm going to check the brachial pulse on the both sides, the radial pulse. Okay, so the pulses are equal and strong the pulses are strong and equal bilaterally, and the rate is 82 beats per minute, and the strength is +2. Now I'm going to check the dorsal peries that is present in the bony prominence of the navicular bone on the both sides, and the posterior tibia that is present in the interior side of the ankle. Okay, so the pulses are strong and present on the both sides. Do you have any pain?
No.
Okay, so there is no any pitting edema, no swelling over the arms. Okay, so the nails looks all clear. Okay, so that's all for the head to toe examination for me. Do you have any question? Okay, so I'm gonna perform hand hygiene and I will document everything. So I'm done with my head to toe examination, and this is the 360 view of my room. And that's all. Thank you so much, Professor.